recording has also started, so we can start the session.
So I'll go with my presentation. Is that okay with you all?
Just 1 minute, DJ. I think Vishnu will start the proceedings and then we will hand over to you.
Yeah, sure.
Good evening, friends. Good evening, participants. Myself, CA Rajesh Hamberam, President of VIP Road Chartered Accountant Association. Welcome all of you on this very unique program on the facts and myths behind COVID-19 and the life after COVID-19. And we have the great opportunity to hear two doctors, two prominent and young doctors from UK, Dr. Pradip Singh and Dr. Rajesh Hamberam. You are very much aware that the entire world had seen a seesaw change and that everything has turned 360-degree after this COVID. And the entire world is facing this pandemic. Everybody is trying to cope with this situation. But there are various things which are coming to mind: what is the treatment, whether we should be afraid of corona. So many things are there. And for this, we have two doctors. Now I hand over the proceedings to CA Vishnu Kumar Tilchan, who will introduce the speaker. We have also the privilege of attendance of our past President CA Vasudev Agarwal, who will be coordinating this program. Over to Vishnu, please.
Thank you, Mr. President. My dear audience, my colleagues, we all have faced a very unpredictable situation in our life due to COVID. I think nobody could have even imagined that it could happen. Just immediately the things are pronounced by the Prime Minister and everything is shut down. Without any knowing what is going on, what will happen, nothing, we don't know anything. And the effect of COVID is so deep that even it was termed as a pandemic by the WHO. So how much it is serious for us, for a human being, even the existence was challenged by the small coronavirus. And friends, and for this we are very much, should be very much careful that what it is actually, and who will deal us, who will see us what is right, what is wrong. And for that we have two friends, my bosom friends, Dr. Rajesh and Dr. Pradip, who will teach us, who will share their experiences, who will say all of us, our audience, that what should be done during the COVID and after the COVID. Hence, our association has organized this program for the benefit of the audiences. And friends, just say कि हम लोग बोलते हैं कि हम लोग चार्टर्ड अकाउंटेंट एक फाइनेंशियल कंसल्टेंट हैं, हमारे डॉक्टर साहब भी हमारे हेल्थ कंसल्टेंट हैं, जिनके बिना हमारा एग्जिस्टेंस खतरे में है. इस पर्पस से मैं अब आई एम वेरी मच थैंकफुल टू डॉक्टर प्रदीप एंड डॉक्टर राजेश. To my personal experience, they are very energetic and very academic people, and hopefully they will clear all our doubts. Without saying much, now I hand over the proceedings to our beloved past president, CA Vasudev Agarwal ji, who is very energetic, dynamic, and who have the problem-solving attitude. He is one of the pillars of our association. We always take guidance and support from him whenever we require. Now, Vasudev bhaiya, I request you to please take up charge of this session and take up the proceedings ahead. Thank you.
Thank you, Vishnu, for your kind and words of appreciation. And it's really moment of privilege for me in this session to interact with two globally famed doctors who are with us today. Secondly, I'm also privileged that today VIPCA is a big banner in comparison to my presidency in the year 2002-03, means 18 years back. Dr. Pradeep and Dr. Rajesh are here, so I would like to tell something about VIP Road Chartered Accountant Association, shortly known as VIPCA. VIPCA is mainly focusing on academic programs. That is the main focus, to update our members regarding the profession knowledge. Secondly, fellowship. Fellowship is also the main emphasis of VIPCA. And third, sports activities. And in all three activities, VIPCA has its own presence amongst other study circles or associations. This is today's topic is very relevant and important topic. What are the myths and truths about COVID-19? And what is the life during this COVID and what will be the life after COVID? And to resolve, to get the answer of all these questions, we have very knowledgeable speakers today, Dr. Rajesh and Dr. Pradip. So before I start the proceedings and deliberations of both the learned speakers, I would request Neeraj Agarwal, our member and executive committee member also, to introduce both the speakers formally. Neeraj Agarwal, please. Neeraj.
I think Neeraj dropped out just.
Yeah, Rahul. अगर नीरज नहीं है तो विष्णु, you can introduce.
Vishnu, please continue.
Yes, I can introduce.
Yeah.
Please go.
Just a minute. Hello, friends. Hello. Hello.
Go ahead, Vishnu, we can hear you. Go on.
I'm going to introduce first Dr. Rajesh Hamberam. Dr. Rajesh Hamberam lives and works as a senior consultant physician in Midway, UK, and he also is the head of his department. He is also the chair for the Southeast of England branch of BUS and sits in the National Clinical Governance Committee of BUS. He is also a specialty advisor at the Royal College of Physicians, London. He is closely involved in the strategic and operational aspects of health care planning and delivery in this region, working closely with the commissioners of patient groups, wider NHS, and the other stakeholders. He is passionate about teaching and training, including the medical and nursing students, healthcare workers, including doctors and nurses. His special areas of interest is infectious diseases. Dr. Rajesh Hamberam was born in Bhagalpur, Bihar, and studied in two of the most popular schools of the city named St. Joseph School and Mount SSC schools. He then trained in medicine, MBBS, at the very prestigious Christian College of CMC, Vellore in Tamil Nadu. After completing internship in CMC, he moved to UK for higher medical training and was worked in many medical specialties, including general physician, respiratory medicine, cardiology, gastroenterology, hematology, endocrinology, elderly care, HIV medicine. He achieved MRCP and after further training got registered in the specialist register. During his training, he worked in London, Birmingham and Edinburgh, and as a consultant he has worked in Sheffield, Belfast and finally settled in Medway in Kent. He is also elected as a Fellow of Royal College of Physicians, UK. He is now settled with his wife, Dr. Kashmir Devising, consultant in acute internal medicine, and their 5-year-old son, Dutch. Although he lives in the UK, Dr. Rajesh Hamberam is very passionate about his home country, India, and the well-being of the Indians. Thank you, Mr. Rajesh, and we are thankful to have you with our association for the best guidance to us. Thank you, Rajesh. Now, I am going to introduce Dr. Pradip.
Neeraj is here. Neeraj is here. He can introduce.
Dr. Pradip के लिए बोल देंगे.
Neeraj, please.
A very good evening to everybody. The line got disconnected, hence got disconnected for the timing. I welcome both the doctors, Dr. Rajesh and Dr. Pradip Singh on this webinar. Vishnu has already introduced Dr. Rajesh Hamberam, and I take this pleasure of introducing Dr. Pradip Singh. He is an acute medicine consultant and MBBS MRCP UK, having fellowship in intensive care medicine. He is associated with Princess Royal University Hospital, King's College Emeritus Foundation Trust UK. With these words, I welcome you, Dr. Singh, on this webinar on this important topic. Over to Vasudev Reddy on this matter.
Thank you, Neeraj and Vishnu. So, friends, we all know that this form of COVID has caused pandemic across the world, as our President, Mr. Rajesh Singhania, has mentioned in his speech. Now we stand at the fifth or sixth position, that is after UK, USA, Brazil, Russia, and there are several myths in social media also. But what are the myths, and out of that myths, which are truth? For that, we have invited these two learned doctors to tell what is the myth and what is the truth. So we will not waste much time, and we will invite for their deliberation. Then we will invite all the participants are requested to send their questions through chat box, or they can raise their hands for their clarification of their queries, and we will make sure that all the questions will be taken up, and all the queries will be resolved before this session comes to an end. For deliberation of this topic, I would invite first of all Dr. Pradip Singh, who is acute medicine consultant in UK, for his deliberation, and I request Dr. Pradip Singh to start his deliberation.
Well, thank you. Thank you so much. I'm Dr. Pradip, as I've already been introduced as an acute medicine consultant. Just to add on that, I have been recently shifted my base from India to UK, possibly just before the hard times. And it was great learning the experiences over there, combining with my Indian experience. So today we are going to deal with this elaborated topic, that's facts and myths and life during and after COVID. Practically speaking, no one has an answer to this particular thing. So because this is an unknown enemy which we are actually facing, and it's still a learning process for all of us. So even if you ask as a medic, do we know everything? The answer is no. And do you have any treatment? The answer again is no. So old quotation still works better. Prevention is better than cure, and that is where everybody is harping and everybody is working on. So I'll be discussing some salient features which has been collected, majorly focusing on the Indian scenario as Indian epidemiology. And I believe my colleague Dr. Rajesh will be dealing with the EU UK counterpart, and we will be explaining the epidemiology in more detail. So, well, as Mr. Agarwal has clearly said, that's the standing statistics. India stands fifth, no doubt. And you can see this is from the World Corona Tracker, what I have collected, that we are still having this huge amount of cases, and somewhere around 6.66 millions. You can add another 12,800 cases to it, with that amounting to more than 43,000. And that's pretty significant. And in India, the rise is phenomenal, and it's rising in spite of the lockdown. That's pretty worrisome part. And it's standing at fifth position, as you can see. So just a bit about what exactly we are dealing with. What is this corona? Just to give you an outline, because in short, I understand that I'm not dealing with a medics crowd. So I'll try to make it as simple as in common terms, in a layman's language, so that things happen smoothly. So basically, WHO has calibrated this and has named this virus as severe acute respiratory syndrome coronavirus 2. It is, well, I lost my presentation. Yeah. So this is actually made of proteins and a single strand of RNA, and it needs
Sir,
host.
just hold on for 1 minute. Sir. Just
yeah.
Vasubhaya, your screen has started sharing. Request you to please stop that.
ठीक कर देते हैं, अभी कर देते हैं.
Sir, please go ahead and reshare your screen, Pradeep ji.
Okay, give me a moment.
Yes, sir, we can see your screen. Yes.
Okay. Is it okay now?
Yes, yes, we can hear you, sir. Please go ahead.
Okay, so basics about COVID-19. What it is actually? It is caused by a virus which has been named by WHO as severe acute respiratory syndrome coronavirus 2. That's more of a medical term because it is very closely resembling SARS, and it is made of 4 proteins in single strand RNA. That's just for the knowledge. We cannot go in depth explaining you about this. So disease which it causes is called as COVID-19. So the disease is called as COVID-19. And the modes of transmission is primarily transmitted between people through respiratory droplet and contact routes. To elaborate on this, like if you cough and sneeze and then the respiratory droplets come out, and if you're into close contact within a meter, then there are high chances that you may get infected. Or if these respiratory droplets contaminate the objects and like tables, chairs, or any inanimate objects, from there also your hands can get soiled and it can contaminate you. The airborne transmission is also there, but that is more of people with dealing with the medical procedures, like when we put a tube inside the windpipe to salvage the patient, or we give them high oxygens. Then this airborne transmission, the droplets get broken up into very fine particles, and they can also contaminate and actually uh, make you symptomatic and infected with the disease. So this is basically about the coronavirus and the modes of transmission, which is very simple to understand actually. It's very simple. The virus is also very simple. The only thing we don't have an answer is how to deal with it. The characteristic of coronavirus, its survivability outside the body, 1 to 2 days on non-porous surfaces, 8 to 12 hours on porous surfaces. Currently, this information on 2019 nCoV is not clear. There will be many calibrations, and it is for this many hours on copper vessels and this many hour on iron and tables. It is already floating on the social media. So that's not point of a discussion. We have to deal with the facts and not the myths. Okay, so the ultimate underline is simple hand washing with soap and water and other infectants are enough to kill this virus, and that is the mainstay of this thing. Incubation period and clinical manifestations of COVID-19 disease. The incubation period ranges from 2 to 14 days with a median time of 4 to 5 days from exposure. So once you're exposed and you're developing this clinical symptoms, it fluctuates between 2 to 14 days. A serial interval is there where in layman term, if I have to explain you, one infected patient between and another infected patient, the difference between them is serial interval, and it is estimated to be 5 to 6 days. If I compare with influenza virus, it's just 3 days for influenza virus. The reproductive number, the cause why it is actually increasing and exponentially. If a patient gets infected with coronavirus, the number of secondary infections generated from this one infected individual is between 2 and 2.5. You can take around 3, which is much higher than that for influenza. So that is causing, that's the reason why the spread is very high. So definition of contact as per Ministry of Family Health and Welfare India. A contact is a person that is involved in any of the following: providing direct care without proper personal protective equipment for COVID-19 patients, staying in the same close environment of COVID-19 patient, including workplace, classroom, household gatherings, traveling together in close proximity of less than equal to 1 meter with a symptomatic person who later tested positive for COVID-19. So these are definition of contact. So who is at risk? Now this is a tricky situation. If someone say he's corona positive, and this is a vulnerable crowd which is actually at risk. You can say doctors, nurses, elderly, and immunocompromised people. They are more at risk because they can contract easily and they can manifestate badly. They don't usually get resolved that fast as an healthy individual. Doctors and medics, they are in the environment and they're multiple times they're getting exposed to this. So that's the reason why they are very much vulnerable. So if you see, if we don't check the spread, then everyone, they fall into this risk category. So from corona positive, vulnerable, and if we don't check, so everyone, they fall into the risk category. So moral is everyone is at risk unless we definitely keep a check on spread. This is a hierarchy of control which has been taken by CDC USA. So this is basically used in hospital environment. This is just to explain that when we have this communicable diseases which can easily be communicated from one patient to another, how we actually try to control. You can see that most effective method is in blue and the least effective is in red. So the methods are elimination, where physically we remove the hazard; substitution, we replace the hazard; engineering controls isolate people from the hazard; administrative controls change the way people work; and the last one is protect the worker with personal protective equipment when most of the things are not working. So you can very well see that we are almost reaching to the last resort, because even after all this, we are not able to check the spread and stop it at all levels. So PPE has become the last resort, but it is right now the main resort, because you have to protect the workers. So how do we go with the prevention and control of COVID-19 as per the epidemiological studies? The general preventive measures, which are very simple and very effective, it's basically for almost all the communicable diseases which spreads from the respiratory droplets. It's hand hygiene, cough etiquettes, environmental sanitations, use of personal protective equipments, social distancing. And for the administrative level, it is screening, quarantine, surveillance, and preparedness, how you actually deal with the situation. So these are the methods which help in prevention and control of COVID-19. So just to elaborate on those, it will be dealt in next presentation in detail. Hand hygiene, cough etiquettes, and environmental sanitation. I'm just giving you the gist. The do's: wash your hand with soap and water regularly for at least 40 to 60 seconds. If soap and water is not available, use hand sanitizers, which contains alcohol around 60 to 70%. Wash hands before touching eyes, nose, and mouth. For any flu-like symptoms, contact physicians or a helpline. If you have got a unique helpline, like Gujarat has got 104. I believe in West Bengal, we still don't have one particular helpline which can guide us further. We need to follow cough etiquettes. Cover your nose and mouth while coughing and sneezing with tissue or handkerchief. Throw used tissues immediately in closed bins. Hello. After use, sneeze and cough in inner side of your elbow. Don'ts: avoid shaking hands. Have Avoid having close contact with anyone experiencing symptoms. Avoid spitting in public. Avoid being part of large gatherings. Avoid part of rumors, because this is one thing which is going to have a bad impact of COVID-19, possibly even after things get settled. Use of personal protective measures. Use of face mask. Face mask. Initially, it was restricted for few selected crowd, but now it seems WHO has gone with a recommendation where it is insisting on use of face masks in public and in any gathering, and with hand hygiene as well. So these are a few preventive measures, which general measures which we are supposed to take. Social distancing, this is one of the mainstay which will be dealt further into the next presentation. Just to give you a gist, avoid non-essential travel, meet through video conferencing like the way we are doing right now, closing of educational institutes, recreation centers, avoid travel unnecessarily, essential correspondence on official email, and avoid sending files. At risk people like older and pregnant ladies, people having underlying conditions should take extra precautions. Environmental sanitations, you need to clean, disinfect the frequently touched surfaces of quarantined room, bed frames, tables daily with 1% sodium hypochlorite solution. CDC says that we can also use bleaching powder in a ratio of 1 teaspoon bleaching powder with 1 cup of water if you don't have sodium hypochlorite solution. And also you need to clean and disinfect toilet surfaces daily with regular household bleach solution and phenolic disinfectants. Clean the cloths and other linen used by the person separately using common household detergent. So these are bare minimum things what we can do to prevent. Now the best part what we need to discuss about the Indian scenario. If we go with the data as of today, what we can see that the case fatality rate, it's 3.1%, which is at par with what WHO says. Okay, this is as of May. Sorry, that's 2020, and it is among the lowest in the countries with more than 1 lakh cases and much below world average. But is that the right figure or not? It's very hard to say, because are we testing enough? That's a question we need to answer. Though the testing rates have improved and increased, but still are we touching the baseline or the required limits? It's still not known to anybody. The epidemiology people are working on it, and still they're trying to resolve as much as possible. This is one of the clippings from Times of India, because it has been presented to. Okay. By IDSP state surveillance units. Just to give you an idea, this is the Indian scenario. The fatality rate is standing at 3.1. Majorly females were exposed when the total was around 2206. This data has taken from April. This is just to show you the highlights, how it is fluctuating between genders and the ages. Okay, you can see that male people are more vulnerable to the infection, and this age group of 60 to 74 is more vulnerable as per the case fatality rates are concerned. This slide has been taken from Ministry of Health and Family Welfare India, as well as Gujarat government, because they give a kind of clear figure for a comparison. What is noted and what is floating is a myth, not exactly myth, most of them are facts, that the people who are having certain comorbid conditions are actually more vulnerable to these infections, and the fatality rates are higher on them. The noteworthy part is the study has been taken from China. We still don't have our own study. You can note that people who are not having comorbid condition is the fatality is somewhere around 1%, not more than that. Okay, but as this disease comes into play, like cardiovascular disease, it soars up almost 10 times to 10.5%. In diabetes, it is 7.3%. In people having respiratory problems, asthma, COPD, and other lung problems, it is somewhere around 6.3%, and people having malignancies and cancers are having 5.6%. So overall comorbid condition is standing as 3%. So that is how it jumps whenever somebody is having a comorbid condition. Another problem is age. The age calculations are not done, but it is seen that vulnerable elderly people are more vulnerable. And now this word elderly fluctuates from country to country. Okay, and possibly in UK it is more. You can say that it's more than 80-year-old people who are more vulnerable to, because of the age, to case fatality part. Now going to a bit of case definition, when do we suspect like we are having this infection of coronavirus? With present scenario, these are the few points which are taken into consideration to define the cases. All symptomatic individuals who have undertaken international travel in last 14 days, or all symptomatic contacts of laboratory confirmed cases, or all symptomatic healthcare personnels, or all hospitalized patients with severe acute respiratory illness, which has symptoms like cough, shortness of breath, and fever, or asymptomatic direct and high risk contacts of a confirmed case, who should be tested once between day 5 and day 14 after the contact. So these are by case definition are the one where we are suspecting that these people can be infected with coronavirus, and the symptoms what they are possibly having is because of COVID-19 disease. The clinical features are very non-specific. I'll be explaining in that in next slide. Okay, so COVID-19 may present as mild to moderate. Majorly in 80% of cases, it's mild and gets resolved. And moderate to severe is again a very blurred line when the moderate converts into severe illness and moderate get converted into mild illness. So it's very hard to comment on that particular thing. Okay. The severe pneumonias can land up with ARDS, sepsis, and shock. These are conditions where the organ failures actually start, and it is very hard to save this kind of people. So early recognitions of suspected patients allows for timely initiations of infection practices and controls. Early identification of those with severe manifestations allows for immediate optimized supportive care treatments and safe rapid admission to intensive care. So that's the reason why it is important to identify the cases as early as possible so that they can get the supportive treatment. So clinical symptom associated with COVID-19, the uncomplicated cases, like I said, it's somewhere around 80%. The patients with uncomplicated upper respiratory viral, they present just like upper respiratory tract viral infection. Commonly, if I have to talk about West Bengal scenario or basically Indian scenario, so you can, we used to take an over-the-counter antibiotics, do gargles and take paracetamol, that was enough. So it is very easy to miss on this particular thing because this is a virus which is not going to respond to all those medicines. So these are non-specific symptoms like fever, cough, sore throat, nasal congestion, malaise, and headache. The elderly and immunocompromised people may present with some atypical symptoms like nausea and diarrhea. So these are some atypical findings which can also as well happen. People having mild pneumonia, they were present with the previous symptoms what we said, which were non-specific, but together with the breathing difficulty, the respiratory rate in adult, you can say that it crosses more than 30 and he starts panting. Sorry, he starts panting and you can see that he's breathing very heavy. So these are the cases where we say that it's mild. Again, like it's easy to develop into moderate to severe syndromes. But if the oxygen saturations are fine, then we calibrate this as mild pneumonia. Specifically, this is clinical part, but if you add on an X-ray, that's going to help you more. If the X-ray is not showing anything, then we consider this to be a mild pneumonia. Moderate pneumonia to severe pneumonia. Patients having features of uncomplicated illness, adolescent or adult, they're having a respiratory rate more than 30, is panting very badly, is breathing very heavy. The saturations level which we put on the probe and see, it shows how much oxygen is there in your blood is less than 90%. Then we take this cases as pretty seriously because they are the severe cases who immediately require support and they may land up with ventilator support. Well, just to give an idea about the children, though I'm an acute medicine consultant, just and for an idea's sake, this has been taken from Ministry of Health and Family Welfare. The child with cough or difficulty in breathing, at least one of the following, if it is present, he is having fever, cough, and he's having breathing difficulty, he's panting, but you see that he's turning blue, and his oxygen levels are less than 90%, and the chest is indrawing, like he's breathing so heavy, the chest is going inside and outside. Okay, or he's not able to breastfeed or drink. He's the patient is having lethargy, or he's getting into altered mental status and unconscious, or he's having a convulsion. Then these are the people who can have this severe pneumonia, and they need immediate attention, and they may require a life support at that least. So lab investigations, which is collected, and this is something which is kind of not very organized, or where exactly people who are suspecting themselves to have this infection, so where exactly they need to go. So they are guided by government protocols that there are some selected infectious disease hospital, or if you go to any emergency of any hospital, they will route you to the respective place where you need to go and get your samples done. The samples which is taken initially and easily, it's a nasal swab and a throat swab. Is basically we insert a stick with a cotton at the other end, and we scratch your back of your neck, and also we put it inside the nose, the separate stick, and we collect the aspirate from that area, and we send that in a viral medium for checking with this coronavirus infection. So other samples which is mentioned over here is bronchoalveolar lavage, tracheal aspirate, and sputum. Sputums are not that very specific, but bronchoalveolar lavage and tracheal aspirate. This is tracheal aspirate is from the windpipe and bronchoalveolar lavage is from the lung, which is done by the respiratory physicians by putting in a camera pipe inside the windpipe into the lungs. Once you're having all this suspicion, we also do this blood and stool and urine to see how far the things are. So collection of oropharyngeal and nasopharyngeal swabs as per Indian protocol is within 3 days of the symptom onset and no later than 7 days. Preferably prior to initiation of any antimicrobial chemoprophylaxis or therapy to cut down on the negative rates. Other lab findings are the routine blood, which we call as complete blood count. The important part is if we see the ratio of neutrophils and lymphocytes, basically lymphocyte is on the lower side, that these cases are actually having poor prognosis. This data has specifically come from Gujarat Health Department. So this is what they're following. They're looking at this ratio, neutrophil and lymphocyte ratio, and it is also endorsed by Ministry of Health and Family Welfare. So this is a very common test, but it gives you an elaboration of whether how bad is the patient. And there are certain more tests. It's more of a medic part actually, where we see what exactly the patient is undergoing, whether the inflammation inside the patient is very high or not. So we do few more tests like IL-6 and ferritin. We see whether the heart is functioning properly or not. We do this. So this is to find out how severe the patient is, other than the clinical part. Radiologically, we do a CT scan to see whether the lungs are loaded with infiltrates and whether it is getting stiff, and that's the reason why the patient is not able to breathe. So that gives us another clue that how early we can consider going with a ventilation. And usually it is seen as a bilateral shadows in CT scan. If suppose it is coming as only in one lung, there is a shadow, then it can be a normal infection, not necessarily COVID. So CT scan has got some role, and it's actually helping a lot because the results come very early. X-rays are done easily at the bedside, so they can be informative, but CT scan are the more preferred ones. Who should be tested? This is as per ICMR. These are the Indian data, and majorly you can take this as a blueprint, and this is followed all over the world with a few specific things here and there. So all symptomatic individuals who have undertaken international travel in last 14 days, or all symptomatic contacts, mark the word symptomatic, people who are having symptoms, only those people are undergoing the test. So all symptomatic contacts of lab confirmed cases, all symptomatic healthcare workers, all hospitalized patients with severe acute respiratory illness, and asymptomatic direct and high risk contacts of confirmed cases should be tested once between day 5 and 15 of coming of his and her contact of the COVID positive patient. So what are the tests what we do actually? So if you ask me, there is no validated serological test still available. We have got only molecular test available, and that is real-time PCR. We call that as an RT-PCR in short form. Okay, and the lab protocols are followed as designed by WHO guidance. And again, this whole thing is for medics to understand. So what we need to take that the only test which is helping to detect corona positive cases are real-time PCR. So what is the management? This is the interesting part. We only go with the symptomatic management. When the oxygen is on the lower side, we support by giving oxygen, general treatment measures, hydrations, antibiotics. If you're thinking that with this corona infection, you're still having some bacterial infections, are we having any antibiotics medicine for SARS-CoV-2? Is there any at all? Now that's a big question which the whole world is fighting on. The answer is still no to whatever evidence-based medicines we are having. What I find, and I believe Dr. Rajesh will agree with this, that in India we are having more of an experience-based medicines going on rather than evidence-based, because there are few medicines which are running, being used all over the places in India, and that's also undergoing a media hype, like hydroxychloroquine and azithromycin and few more. I'll touch on that as well. So medicinal management of COVID-19 in India, it varies from institute to institute as we don't have a set protocol. I'll just show you one of this. I won't name the hospital, but this is one of the protocol what they follow. For the milder disease, they are going with a hydroxychloroquine with azithromycin. If there is no contraindication, if there is an at all contraindication, they are going with ivermectin and doxycycline. The rationale is still not available. It's few months back in Ministry of Health and Family Welfare website. There was this use of hydroxychloroquine also for patients as well as prophylaxis was given, but the guidelines are changing. I still don't know what rationale was there to start with this. The evidence are very minimal and rather not very supportive as well. So you can see that if the saturation they're targeting somewhere around 90 to 93 percent, and then they are adding some supportive medicines, which are kind of medicines which is called as blood thinners, but that is not for corona as such, but that is just to support that the blood doesn't get clot. So these are the particular tests what they do. They are also giving steroids for minimum 5 days if the patient is requiring oxygen, and they are adding broad spectrum antibiotic if they're finding any evidence of any other infection is there. That's fine, but they can. Uh, Remdesivir, this is another drug which is like undergoing rounds all over the world. Okay, that is being practiced, and this is given when they are able to measure this interleukin 6 levels are on the higher side, and tocilizumab is being given when the oxygen requirements are going up and interleukin 6 are on the higher side. So another thing what they are following is giving plasma therapy. This is also doing rounds, and it is being vouched by many of the political leaders that these are giving results, but there is no fluctuation in mortality as seen. So it's very hard to comment whether it is giving a false hope or it is giving some hope, and whether it is going to be endorsed as a particular treatment in near future, because right now evidence are very contradictory to all this. But this is being practiced. This is one of the hospitals medical plan to deal with corona infected cases. So if I have to summarize in a little, are there any proven medicine not till date that we know of? SCQS, much hyped medicine, but no proven data. Even trial was stopped by WHO, but was restarted again a couple of days back. The reasons are not known. Are they having any data which is supportive or not? That has not been made public. Plasma therapy, it there are few clinicians who are vouching for plasma therapies, especially from the down south in Kerala, and they said that they were able to stop mortalities, and presently they're showing the best results. But worldwide, no proven benefit has been noted. No change in mortality. By mortality, I mean the fatality rates. Okay, remdesivir has shown encouraging results, but if you go practically, there is no change in mortality either. So there are no scientifically proven medicine till date, which is going to help with this corona infection present. Uh, any proven vaccines? No vaccine till available. Research is still ongoing. No one knows when it is going to come out. There are some dates already doing rounds in social media and hyped very nicely, but those are political speculations. Some say that by September it will be launched in UK. Uh, it is good if it is get launched, but we are not very sure whether it is at all going to happen or not. It all depends on the data. It all depends on how it is going to perform, and possibly I believe 15 days back it was declared again on a political outfit that in India it will be they will be able to come with this vaccine in December. So these are all political speculations date which are being made public, possibly to create some hope, but till date, if you go with the facts, there is no particular date whether we are able to at all get a vaccine or not, and whether that is going to actually help or not. We still don't have such a date. So we are going with the political speculations. Now, just to give you an idea about the discharge policy, because these are a few things which we all should know when this patient needs to be moved out. People who are infected with whatever cases, mild, moderate, severe, but they're fit to be getting discharged. So hospital goes with a policy, but these are the policy which has been designed by Ministry of Health and Family Welfare. So what they say, send clinical samples for lab confirmation to designated laboratories. That is first. Case will be kept in isolation at health facility till the time of receipt of lab results and given symptomatic treatment as per existing guidelines. These are for symptomatic people. If lab results are negative, the discharges of patient will be governed by his provisional confirmed diagnosis, and it is up to treating physician to take this decision. This is something which is something really serious, because many a times results they do come negative. So the clinical suspicion has to be intact whether we have to discharge this patient or not. So this is one thing which government has given to the clinicians. And if the clinician is having a bare minimum doubt that it is not corona, so he can basically ask the patient to get discharged and be in home quarantine. The case shall still be monitored for 14 days after this last contact with confirmed 2019 nCoV case. In case lab results are positive for nCoV, the case shall be managed as per confirmed case management protocol. The case shall be discharged only. This is for the proven cases who are corona positive. The case shall be discharged only after evidence of chest radiographic clearance and viral clearance in respiratory samples of 2 specimens, which comes as negative in 24 within a period of 24 hours. When 2 specimens are negative, then only they are thought to be a negative, and then they can be considered for discharge. So these are the discharge policies which is supposed to be followed in all the hospital, and this is for your awareness, because it becomes a stigma for the corona positive patients who gets discharged, and they are kind of isolated in their own circle. So this is what needs to be known. Screening and quarantine, again, that these are dealt by the administrative people. So all passengers coming from affected countries are screened at entry point. Suspected cases are referred to hospital, and asymptomatic cases are advised for home quarantine for 14 days. Majorly, it is being followed, and recently, even in UK, this home quarantine part has come in with some exceptions. But what exactly is quarantine? Remember, this is important. Refers to separation of individuals who are not yet ill but have been exposed to COVID-19. That means any person who is not ill but he has been suspected to be exposed to COVID-19, they are the people who are eligible for quarantine. Once, because they have got a potential to become ill. So if they become ill, then you need an institutional care. Home quarantine is applicable for asymptomatic passenger and contacts who meet the definition of contacts which we have discussed. So what exactly we do in home quarantine? This is just an elaboration. The home quarantine person should be staying in a well-ventilated single room, preferably with an attached separate toilet. He needs to stay away from elderly people, people who are at high risk, pregnant women, children, and persons with comorbidity within household. Restrict his or her movement within the house. Public health measures by quarantine person to be maintained is maintain hand hygiene, avoid sharing household items, wear a surgical mask at all times, disinfect the used mask, and if symptoms appear, cough, fever, difficulty in breathing, he or she should immediately inform to the nearest health center. So this is for the quarantine person. Instructions for the family members who are dealing with a person who has been quarantined at home. Assign only one family member for taking care. Avoid shaking the soiled linen or having direct contact with skin. Use disposable gloves when cleaning the surfaces or handling soiled linen. Wash hands after removing gloves. Visitors should not be allowed. That's important. So environmental sanitation, which is again so many things are going on rounds. God knows, I have seen people asking me, rather than asking me use of aloe vera and neem also to clean desk. I don't know if there is any study to support those or not, but this is the one which is actually followed. The clean and disinfect the frequently touched surfaces of quarantine room like bed frames, tables daily with 1% sodium hypochlorite solution. Again, this is the hospital solutions. It is in India, it is freely available. It's very hard for me to comment on the UK part. But CDC also says that if you don't have the access to 1% sodium hypochlorite solution, you can take 1 teaspoon of normal bleaching powder in 1 cup of water, and you can create a solution. You can clean with that as well. Also, clean and disinfect toilet surfaces daily with regular household bleach solution, phenolic disinfectants. Clean the cloths and other linen used by persons separately using common household detergent. So facts and myths. I've been dealing more with the facts presently. Myths. There is no end to myths. So the questions which will be coming on the myths will be answered, and but then only possibly we can clear those myths. Like a few which I know about is drinking hot water, doing gargles, and there was some social media video also doing around where a gentleman was educating to inhale alcohol to give a coating to the trachea and respiratory um, tree of our body so that we don't suffer this coronavirus. I don't know where this has cropped in and there is any evidence or not. Till date, as per my knowledge, I have, there is no such evidence that it is going to help anyway. If there is no harm, you can practice. That's your area. But scientifically, no. Okay. So impact of COVID, we are in nascent stage to judge it. It's too early to comment what early impact we can see. We have already seen that there had been a lockdown to cut down on the spread, and the lockdown has already had a severe impact on the employment, finances, and businesses, retail businesses as such, airline industries, and many industries. So these are early impact what we can see, and you guys are the best judge how it is going to impact further financially, economically, and in other sectors as well. But mental, physical, and economical impact I've discussed. Mental and physical, yes, it is there. Initially, the socialization which was happening very easily, very cozily, and now you can see that people are kind of afraid to meet with another human being. So such is the kind of mental and physical impact. Though we are encouraging social distancing, what we can see is more of a mental distancing as well, which is happening actually. Now, change in this socialization, will it be permanent? That's very hard to comment right now. Possibly in coming days, when things get resolved, and then only we can know whether the people will be more into socialization or not. Human are known for socialization, so whether that is going to happen or not, or we'll be in our nutshells, we'll be away from each other. So it's too hard to comment what exactly COVID-19 is going to bring in future. Early impacts are seen, and moderate and late impacts are yet to be noticed. We have to brace ourselves because anything is going to come. Another thing what we are afraid of is if a second wave comes and the insult is added to another insult, we don't know where we are going to land up. So it's like we are fighting an unknown enemy. So all we have to do is protect ourselves and protect our all the people around us. So old quotation still works. Prevention is better than cure. So that's what we need to follow. That's the only proven benefit of providing thing available right now. That's the disclaimers. A few things have been taken from Ministry of Health and Family Welfare and Gujarat government. They've got a nice protocol as such, and few from the international areas. Thank you. That's from my side.
Thank you, Dr. Pradip Singh, for excellent presentation. You have explained very well about what is COVID, how it can affect, what are the data, and what are the preventive measures. Hello.
Hello. Yes, sir.
Masavia, we can hear you. Please go ahead.
So, out of your presentation, one point that can be myth is in mind that you have given the fatality rate of around 35% between the age of 45 to 59 years. But it is prevailed in social media that it is affecting basically the elderly people. So is it the elderly group, 45 to 59?
Well, what I showed you was one of the data which was given by IDSF surveillance of a state. That was to give you an idea that these are the age group which is actually getting affected. And if you go with the definition of elderly, it is fluctuating between countries to country. Like in UK, it is 80 and above, we call those people as elderly. And from 45 to 70, you'll find that they're much more active than even person like me. Okay. So the case fatality, what has been given is the data which they have collected. This group is, if you go by the chronological number, they look kind of young, but they can possibly also have some comorbid condition with them. So this is the data which has been collected. So we have to be very cautious with this age group. If the data has come, won't say that this is an elderly group, but this can be a vulnerable group. And what I can go with my experience in India, that what I see the disease which crops in is majorly between this 45 years and above. You will see that people are getting vulnerable with diabetes and other things. Okay, so that can be the reason why this group is suffered the most. And it is very hard to comment on people who are above 60 because we still don't have this consensus how many people are actually existing above 60 in the stage group. So you have to standardize those rates. This was just a speculative rate which has come as a surveillance. I shared it with an intent that we have to be alert because we don't have more data other than this. So 45 and above, we have to tick the boxes. Yes, be cautious, be alert, and take all the preventive measures.
So, thank you very much. I will be more alert because I am of this group. So,
Well, shortly I'll be reaching to that as well.
most of us.
Yes,
No,
actually.
you correctly mentioned no end of myths. But there is still one myth that if ventilators are used, mostly the patients are saved. And yeah, you can say that ventilators are safe to life, safe to protect the life of patients. But data shows that 88% patients died when the ventilators are used. Or you can say that when the patients are put in the ventilator, they are in very critical condition. What is the fact?
Well, again, like this, if I leave the COVID-19 away, this fight has always been there that people who are put on ventilators, they never make it. 80% they die. Okay. So that has always been over there. If you ask me, in the present scenario of COVID-19, people who are requiring ventilators are one who are having severely damaged lung. Yes, it's true that people who are landing up with ventilator are subjected to more mortality. They are definitely dying. But as long as patient is alive, you have to support because there are cases where people who have been on ventilator, like 20%, if you talk about, they have survived also. We don't know which 20% is going to make it. So that doesn't stop us from giving a ventilator. The early prevention is best. That is what we can do. If we identify early, possibly we may not have to give ventilator if the patient immune system responds well. But yes, if you land up with ventilator, you have to keep in mind the patient is critical, and we have to pray that he starts responding to that and comes out of it. But yeah, people landing up with ventilators are definitely having a higher mortality.
High rate of
I
mortality.
come in there.
And before I inviting Rajesh Hamberam, the one more question is in mind. Then you have mentioned in your presentation there is no medicine is prescribed and the medicine is varying from hospital to hospital, doctor to doctor. They are prescribing medicines. So if there is no allopathic medicine at present, can the patients opt for the Ayurvedic medicines as one member has asked this question also?
Well, that's a very interesting part. If the Ayurvedic medicine is having any data study, we don't mind endorsing that as well in allopathy. But what I can gauge that it's more of speculations that even if you don't have any symptoms, I give you Ayurvedic medicine, you'll feel good about it. Okay, so it's very hard for me to comment on any other sciences, but there is no data to endorse any of this Ayurvedic part. I'm pretty sure that if it was a wonder drug which was happening, by this time such kind of mortality would not have taken in world. These Ayurvedic medicines, if it was there anyway, or the homeopathic medicines, I think arsenic 30 was on rounds on social media. Okay, so this many deaths will not happen. I'm pretty confident about that.
Ayurvedic medicine means what you have heard in India कि हल्दी का दूध ले लीजिए, काढ़ा ले लीजिए, गर्म पानी पी लीजिए. All these things are prescribed.
But trust me, when I was dealing with patients in UK, I don't know, Dr. Rajesh, you will be knowing about this. I have seen people going with the Chinese herbs and Indian Ayurvedic medicines and turmeric milk. They have taken there as well. And I was surprised that I'm not dealing with the crowd. It looks like more homely atmosphere in UK. Well, if I have to answer Mr. Agarwal on this, well, sir, you can try anything which is not harming you. But like I said, that there is no data to support it. If it was at all saving lives, I'm pretty sure this would have been a wonder drug and all over the world till now, which is not happening. So that shows that it is possibly not working.
Thank you very much, Pradip sir. And now I am inviting Dr. Rajesh for his deliberation, and then we will take the questions from the delegates.
Thank you. Thank you. Thank you, sir. Welcome, Dr. Rajesh. All yours.
Thanks, Pradip. Hi, afternoon, everyone. Can you hear me?
Yeah, yeah.
So I think it's evening there. Firstly, can I just ask the viewers, if they don't mind, if they're using their computers, they could change to split screen rather than on top of them. Secondly, thank you, Pradeep, for an excellent cover. You have done my job very easy because I don't think I have many things to add on to what you have said. However, I would like to give a little bit of UK perspective. I know you have come in quite recently, and I have been around here for now nearly 17, 18 years, 18 years to be precise. And I've seen UK, Europe, and quite a few friends in America. So I'll give slightly global perspective of what's happening with COVID, but also try and cover some of the proven facts. And as you and I would very much agree that there are many ways to, they say cat is, skin a cat, but you must have evidence behind it. So we practice evidence-based medicine. We do respect people's expertise, individual expertise. However, at the end of it, it has to, wo bolte hai na, so sone pe khara, I can't remember the Hindi saying for it, but it has to live up to the evidence and scrutiny. So I'm going to try and do some work on that aspect of it. Okay, so these are my disclaimers. And also before I start, I must thank some people. So that's me. So firstly, I would like to remember and dedicate this to everyone who has lost their lives due to this disease. And a lot of people say, oh, well, why is it so different? People are dying because of malaria. People are dying because of TB. People die of influenza every summer. The difference is that this just hit us very hard, very quickly. This is something which we weren't expecting, and no one was at guard to protect themselves. So therefore, this has been a tragedy, a major tragedy. Some of the other dedications, yes, to my mom, whom I always remember, my family, and my family here, my lovely wife and son. And I would also like to mention Mr. Vishnu Tulsian for inviting me, and his wife, Julie, who you know as Jayashree. We go long back when I used to be, as they say, in my chaddi. So we know each other from very childhood. And all the members of VIPCA, the present and past president included. But I definitely would like to thank everyone in the healthcare who have been working really, really hard across the world. So the doctors, nurses, everyone in the hospital, cleaners in the hospital, and all the key workers, and they're risking their lives actually. So it's sometimes quite disheartening to see how they're treated. Luckily, not everyone is being kicked on their backside and being lynched. So please be mindful when you see one of them. Right. So one of the other thing, because majority of you are from finance background and you are accountants, I just want to say Vishnu has got two of us free of cost. So what I would ask you is to please donate generously and look after your peers, look after those who can't in this really hard time, can't even afford one meal a day. And this is not just the story of India or the so-called developing and underdeveloped country. We are seeing it in UK, we are seeing it everywhere. So please be kind. This is the time to be very kind to everyone else. Okay, some jargons. So we, in doctor, we are a bit exclusive, just like the chartered accountants. They have their own terminologies and we try and figure out what they mean. So we have some of our terminology, but you'll hear this a lot in the news and people talking about it, and you're trying to figure out what does that mean. Pradip has already touched on it. I'll just revise it. So what is R0? A lot of people talk about this because in our area of work, this means a lot. So basically it means if one person gets the virus, how many more are going to get from that person? That's the R0 in simple terms. So it is important because if your R0 value is more than 1, that one person is going to infect more than one people. So it's not going to stop by itself. So जो संक्रमण है वो खुद नहीं रुकेगा क्योंकि एक से ज्यादा है R0 value. What if you bring it down? So अगर आप एक से नीचे ले आते हैं, if it's 0.5, 0.75, slowly that will die out by itself. Now, the most important thing is, how do you know the R0? The problem is, to know the R0, you have to know how many people are infected. Now, it is very, very, very difficult because to know how many people are infected in this world, you have to test all the 7 billion people on this planet, which is practically impossible. Of course, if you're a smaller country like South Korea, you could do it. But if you're a bigger country like UK, it is very difficult. If you are even bigger, like our India or China, it is absolutely impossible unless you have lots of resource. So essentially, it is very difficult to test everyone. If you don't test everyone, you can never know who all are infected. So सब को टेस्ट नहीं करेंगे तो पता ही नहीं चलेगा कि कौन कौन infected है. And that is the biggest problem. And the biggest problem is that every country is doing it differently. So all the data which is coming out is not the same. So in common language, you are trying to compare test match statistics with a one-day statistics with a 2020 statistics. This is, not fair because people take their own time in test match to make a century. In one day, it has to be a bit faster. If you want to make it in 2020, it has to be really fast. So all the data is coming out and people are quite surprised to say, oh, well, this country is doing better, this country is doing worse. So that's one of the problems. Now, going to case fatality rate. Now, you'll hear about this as well a lot. Now, it is essentially those people, it is the number who have died compared to all the diagnosed cases. Now, remember, this is diagnosed case which has had a test and has been positive, and then you're looking out of that how many are dying. So I was looking at India's statistic this morning. The number of tests are not really great. So if you don't test, you don't know how many are positive, and people who are dying of some other cause may actually be dying of corona. So it is difficult to label what and find out what is the case fatality rate. Also, you have to remember this depends on the population. So if we are in a country like Italy or UK, where there's a vast number of people above the age of 50 and 60, there are many more above 80 as a proportion of the total population compared to somewhere like India. So India is a very young country. We don't have many old people. If you look at Japan, they have many old people compared to their younger people. And somewhere in between are European countries, and Italy was the worst because they have very high proportion of old people. So old people are dying easily because of corona. And if they are dying easily, the country statistics will look really bad. So don't base on this your assessment which country is doing better in looking after their citizens, or why is the numbers in places like America, UK, or Italy so bad. However, some countries have done pretty well, even if their population was older. And that is down to, I think, test, track, and isolate. So you test the person, you track the person, find out all the contacts, and isolate. And that is, I think, the key to success. Now, there's something called infection fatality rate. Now, this is the holy grail. This is the nirvana. This is where you want to know about. And this is the death of people among all the infected individuals. So not just whose case was found because of testing, but because they had the infection. Now, this is essentially very difficult. We will never know, but we can only model it. So, we are like accountants, we are also clever people. So our statisticians put in some data into the computer. In the old days, they used to do it with their pen and paper. And then they find out the best possible estimate. Now, everywhere, people use different models, and this can vary a lot. So be mindful when you're looking at data from country. Also remember, some country want to not show that they are having a lot of infection, and some countries are very honest about it. So if you look at Belgium, Belgium has got a very high rate of very high IFR. The reason being, A, they have been very honest, and also they have been testing well. UK, on the other hand, I can't be sure what our actual, we know about the case fatality, but I don't know what the infection fatality rate is. And we may never know because our testing strategy has been less than ideal. Okay, so Pradeep has covered lots of this, and I'm not going to go into the details of it again, but I'm just going to show it in a bit more colorful way, a bit more picture orientated. So as Pradeep had mentioned, transmission is essentially by droplets. Now, droplets can be big, droplets can be very small. So the micro droplets can hang around in the environment for a long period of time. And if you're in a small place, so if you're in an office, you're in a bedroom, like I am at the moment, you are more likely to get the infection if someone else around has coughed. But if you are in the open, if you are in the park, if you are in fields, wherever it is an open space, it is much more likely that the infection is not going to come towards you because the wind will take it away, most likely. So it is always better to be in outer space. However, the problem with our outer space now, or as in outside the house, is that you have too many people. Now, India has got, I don't know, 1.2 billion or 1.3 billion people now. So anywhere you're going to meet people. And therefore, lockdown was very, very important to isolate you. Symptom-wise, they're classic flu-like symptoms. So whatever winter flu you get, and all of us get flu, this is what you're going to get. Fever, cough, sore throat, fatigue, shortness of breath. There are some extra features which are also features of a virus, but has become more prominent in COVID. So we know if you lose sense of smell and taste, so you can't smell something, your wife cooks very nice food and you say, it's not very good today. Think about it again. Because she hasn't changed her cooking, you probably are not able to smell it. And if you don't smell the food properly, you are not going to taste it properly either. Now, headache and muscle aches. And before I go ahead, I have to say that I'm sitting here by God's grace because I'm one of them who has had COVID. So I have had COVID. My wife, who is also a doctor and an acute medical consultant, she has had COVID. So we both have had COVID. And luckily, we didn't need to get admitted in the hospital. We were not very, very unwell, but we had these symptoms. So I had the worst headache. I never get headaches, but this was really bad headache. My muscle was aching like anything. I had diarrhea. And these are not common with all viral. So you don't get diarrhea generally with viral infections. You may, but you may not always. But in this, many people are getting. So be mindful. There are some case reports of odd neurology. People are getting what something's called Bell's palsy, where one side of the face becomes droopy. People are getting some nerve problems, and these are not generally seen in ordinary viruses. Okay, so how do you prevent? Now, of course, with all what Pradeep has already mentioned, Dr. Pradeep, biggest cure or treatment, well, not really cure or treatment, but biggest way to combat this is prevention. So prevention is better than cure is not a small statement, is the biggest statement, and the biggest statement in the current pandemic. It always is true for any disease, but in this pandemic, it can't be even truer. So prevent it. How are you going to do that? So maintain good personal hygiene, safe food practices. Now, washing the hand is perhaps the most important thing you can do. Yes, in the place where you can't get your gel or your sanitizer, where you can't wash your hand, gel and sanitizer are useful. However, if you can, wash your hand even before you think of using sanitizer. Now, when you're coughing, we do have many people who don't use a tissue paper, or who don't use their handkerchief, and they sneeze on everyone else. If you use that, you are preventing all the droplets all around in the environment. And if you, in NHS, the National Health Service I work for, we say, catch it, bin it, kill it. As in, catch it, put it in the bin, and it will die after a while. So please be very careful. Now, in terms of exposure, I will come into more details of it. So since I do miss India and Hindi, I have put it in Hindi as well. I must say I have to thank the International SOS because I borrowed some of the slides from their website. So some of the things I want to do on top of what Pradeep has done is to look at the evidence. So the question is, what is the evidence for social distancing during global pandemics? So we are not just talking of corona, we are talking of all kinds of pandemics. So whether it's SARS, which came earlier, whether it's MERS, swine flu, तो किसी भी तरह का जो pandemic है, उसमें social distancing का क्या value है? Is it effective or not? Now, it is proven that if you stop the spread by not sending certain individual to go out and mix with others, you are very likely going to contain the infection. One of the group of people who are very sort of prone to take this infection away and spread it are children. So I think children need to be kept away from the school till we are sure that they will not go out and spread the infection. Now, how long can you do it? That's the $1,000 question, because you can't do home education forever. So in UK, the schools have just started from last week, and well, this Monday. However, they're only taking very few students in. So key workers or workers who are in hospitals and doing all the essential care, plus some of the vulnerable students. So people who have got some other issues and parents can't look after. You will see that if you change your workplace, like remote working, like we are doing today, we are having a remote meeting, staggered shift. So not everyone starting at 9 o'clock, one starts at 9, other person starts at 12 in the afternoon, another person in the evening, and extended holidays. Now, no one is going to give us extended holidays, let's face it. But if there was big breaks, that would help, because if someone does get infection, they can then isolate and have a longer period away from the crowd. And that has shown to reduce the spread and the peak, because not everyone is going to have the infection at the same time. But of course, as you all are accountants, you will realize that the this has to be balanced with the economy, and that is the biggest question which politicians are facing. So if you ask us as healthcare professionals, as consultants in medicine, what did you do? Yes, shut it down, keep it away, keep people away. But practically, it is not always that easy. Now, one of the things which I was horrified to see, not just in UK, where people go out and they're sitting in beaches, overcrowding, and the shops are having lots of people. And I saw in India as well, where you had everyone lined up to buy alcohol and jumping on top of each other, or thousands of people in the bus terminals in Delhi trying to go away to their villages. Now, there is good evidence that if the interaction is for long, so if they are staying with each other for a long period of time in close proximity, there will be risk of transmission. However, that is nothing compared to what happens when you have a closed room. So in closed room, you can pass it on easily. Whereas if you are in a stadium and watching a cricket match, it is very unlikely you are going to pass to the next person, unless, of course, there's direct contamination. So we have to be pragmatic as well. Now, so self-isolation, what does self-isolation mean? So there are two things which people talk about. One is self-isolation and one is home quarantine. Now, self-isolation is for people who are already infected. If they are infected, your best chance is to keep them away for at least 2 weeks so that they don't shed the virus, they don't bring the virus out from their system and pass it on to someone else. Home quarantine is for people who don't have the actual well, they may have the infection, but they don't have the disease. It's not showing out. It's not out in the open. They're not coughing. They're not having fever. So they may have infection because they have been in contact with people with infection. For them, again, it is important to stay at home for a couple of weeks. Now, I think going forward in future, and this is after COVID. Now, let me tell you, there is no after COVID at the moment. All we can talk about is after lockdown, because COVID is here to stay till we have a proper vaccine. There is nothing else which will just clear it away. It is going to stay with us. However, it may not be as bad as it was during the peak. Now, I don't know what is the peak in India, because looking at the data, it is possible we haven't gone past the peak in India. We know for certain that in Europe, most countries have passed the peak, and even UK has passed the peak, America has passed the peak. So when the peak has passed, it will still be there. Now, in those circumstances, the key thing is to find the person who may have the infection and then isolate them. And there is good evidence. I'm talking all this based on studies done. I'm not detailing the studies. तो मैं जितने भी research है उनका details नहीं दे सकता हूँ क्योंकि it will take a long time. लेकिन I have done the research and I can tell you that these are facts based on proper research, not some gyani telling us or not some politicians telling us. I'm always mindful if the politicians say something. You have to back it with evidence. Okay, so some of the tips. Now, this website is very good. And if you are having an office, if you are having school which you run, if you are having a public place where you work and you run, or you're a valuable member there, please put lots of these signs so people are reminded what they need to do. So social distancing tip, which you know by heart now, everyone knows, they should maintain minimum of 1.5 meters distance, at least 2 meters, to be very safe. If you can go in your vehicles, in India anyway, we are very used to going in our own vehicles because we like that, don't we? So we like to go in our own cars. We don't take public transport. Now is the time to use it. Public transport, of course, is a place where you are going to sit with someone and a group of people for a long period of time. And if you are in the traffic in Calcutta, you probably are going to sit there for 1.5, 2 hours. So yeah, use your transport at the moment. Work from home as far as possible. Now, I understand even in India, there are lots of online services now. So get online deliveries if possible. Don't forget your local vendors though. So your local vendors are very important to your economy. So please don't forget them. But depending on what you're buying, you can use the online version. If you are unwell, please stay at home, even if you think the symptoms are mild, because you may have corona. Now, in UK, we very actively promote people to report it. Now, I understand in India, there's a lot of fear as well, and people don't want the ambulance to come to their house and take their blood and names. I was very surprised, actually. I was really surprised to see names of people being circulated around in social media, in WhatsApp. I mean, that is really not fair, because if someone has got an infection, you don't want to, tell the whole world. You have to find a way to make that person safe and others around him safe. But putting a, 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 a sign outside the house or putting it on social media, name, age, address, I don't know. It is against medical ethics, but there we go. That's the government policy, I suppose. Now, what about work and public place? So this is, I'm talking now after your lockdown. What are the things you should expect to see, and what are the things which might be already in place? So same things, reminder about reminder about maintaining social distancing. Now I have put only patients allowed. For you, it could be only clients, only clients allowed. So of course, in my waiting area, we don't allow, at the moment, we have only one patient at a time. And in the clinic I have, we have capacity for about 40 to 50 patients. So if you are running an office, you may want to be very careful how you're going to entertain your clients. You could put these signs up and also put signs like, please stop, so that not many of the clients are coming together in one place and having a nice gossip, and that there is a gap between them. Now, I'm sure it will not be possible in small offices. So the best thing is not to let everyone come in at the same time. What about the evidence about hand washing, disinfectants, and COVID? Well, it's well known that since mid 19th century, washing hand can save lives. So we know that washing hand is the best way to prevent infection going from one person to the other. And that is true for COVID as well. However, you must wash properly. Now in UK, every year, I get assessed for my technique, how I wash my hand. how I use, how I do my hand, how do I rub the fingers in between. So, sare anguthe ke beech, ungliyon ke beech, how to rub the, sorry, I can't show you, how to rub the thumb, how to do the back of it. So the back side of the hand. And now in UK, we can't wear any clothing like this when I'm working. It has to be up to the elbow. So you have to fold or you have to wear half shirts. So that's something to think about when you're working. Another very important thing is people got very fancy about alcohol gel. Now, alcohol gel or the sanitizers are good. However, they are not as good as soap. So some studies have shown that 99.9% of virus bacteria can be eliminated using soap, a proper soap. If you use alcohol, depending on the strength of the alcohol, so alcohol gel has got strength and the sanitizers. Depending on that, you can achieve up to 99%, but there is still that 1% versus 0.1%. And as accountants, you'll really appreciate there's a big difference between 0.1% and 1%. It's 10 times more. But this is only for very potent gels, and those gels will cause harm to your hand. People can get dermatitis, people can get all kinds of problems. So be careful when you rely solely on hand gels. Think of soap or hand wash. Okay, so in your offices, in your homes, you can print these things out and put it there so that people who come and interact with you, now that you'll be going out to offices, you'll be working from offices, most likely, they do not spread the virus in case they have. Now, as I told you, this is the correct way to wash your hand. You can see it is not a simple process. It is something which has to be done many times. So it becomes a part of your hard drive in the brain, and you automatically do it every time you do it. Now, also, it's very important that if any of your clients or your family members or yourselves are having any of these symptoms, which I have already dealt with and Dr. Pradip has already mentioned in detail, I think it is very important that they seek help and they call their doctors, or they at least isolate themselves, because it doesn't take very long for a virus like this to spread from one person to the other. Now, you will, and you probably have already been seeing that there's a lot of temperature check. And it is important because fever is quite subjective. People can think, oh, I've got a little bit of fever, you know, I'm feeling a bit hot. However, one must be able to document it and get the exact value, because your fever might go up or fever might come down. So it is important to know how much is the fever, and therefore it could be checked. Be mindful that many places will use it. So you have seen it being done in airports, but you may see it happening in malls, you may see it happening in shops, you may see it happening everywhere. You may want to do it yourself. Now, it does not mean that you are discriminating against anyone. It just means you are taking a precaution, and we will have to get used to this way of living for at least in the medium term. May not be in the long term once the vaccine is available, but in the medium term, this is going to happen. Also, in your waiting area, you can tell how many people are actually allowed at a time, so people are warned again. Now, some touchy topic. So this is about face mask, and as Dr. Pradip mentioned in his talk, this is something quite interesting, because if you look at the face mask, now hang on for a second. Yeah, I'm still here. I'm still here. I just I just went into my drawer and I found some of these masks. So I keep it handy in my house. Now, if you will notice, this is the blue surface, or sometimes you'll see the green, and this is the white surface. Now, you have to figure out which is the front, and mine has got elastic band, and there are others which may have these strings. So you need to know how to put it on, and I'll demonstrate to you. But is it any good? Is it useful to wear surgical mask? Well, if you are coughing and everything is going into the air, you might be able to prevent that by using the face mask, because it is physically going to be a barrier between you and someone sitting in the waiting area or your family member. However, is it very effective in preventing things coming into your area, nose, mouth, or eyes? So there are three. Think of all the holes. So throat, nose, and eyes. These are the entry point for the virus primarily. So you touch a surface, and then you take and you do it like that on your face, and there you go. In your eyes, nose, mouth, it has gone. So you can use at least this to close two of them, not all three. You can still get it through the eyes, but you can at least prevent it from coming to your nose. So how are you going to use it? Now, I'm going to put the computer a bit away. Now, don't touch the mask. These are old masks, so don't worry. I'm not using it for actual purpose. I'm just demonstrating. Don't touch the mask. Touch the actual string or the elastic band. Put it on top of your mouth and take it around the... Now, you will see you have to adjust. So now, if it is a fresh mask, you are touching it, it's okay. If you use a gel before you use, it's even better. But make sure it is as airtight as possible. So it goes under the chin and on the nose, on the bridge. When you take it out, it's the most important thing. So when you take it out, I'll show you how to take it out. And bin it. Clean your hand, get on with the next thing. If you are using this, there, over the ears, tie it under and tie it. Some people say you should take it on top of the head. So put it here, tie it over the ears, and the other one tie it at the back. If you are a girl or woman with your thing, I don't know exactly what's it called, but if you have got a bun here, you can take it up and tie it there so it holds in place. Now, it is very important to dispose it carefully and wash your hand. Now, does it help? Well, there are different recommendations. Yes, it prevents spreading virus if you have the virus. It can also protect you if someone is sneezing on your face. If they're very close and they sneeze on you, it can physically protect, but it's not designed for all the virus and bacteria to be protected against. But overall, if both you and the person who has the virus wears it, then it is very effective, which means if everyone wears it, or if many people wear it, like in a bus or in a closed space, it is likely it won't let the virus spread from one person to the other. But be careful how you use it. These are based on study. These were studies done on other viruses, SARS, normal influenza virus, and there are studies now being done on the actual COVID as well. So the other mask which we use in our work when we are dealing with COVID patient is the N95 mask. that is a special mask, and it has got a very high degree of filtration. So it doesn't allow very small particles. So that is extremely helpful. And please don't buy it because it is not actually useful for common scenarios in which you will be. And what that is doing is that is making it unavailable for the doctors and nurses and people who deal with these patients, and for the healthcare workers. So please, N95 mask, I know you can afford it, you all have money, but please avoid buying it unnecessarily, because none of you or majority of you are not going to be doing anything which needs a N95 protection. So I've told you how to put the mask already, and more importantly, how to remove the mask. Because once you have used the mask, that's where all the bacteria, viruses are sitting on the mask. You don't want to hold it and then pass it to someone else or yourself, because you'll be touching your mouth or nose afterwards, and you can spread it to yourself. Now, this is very interesting, and Pradip has really covered it well, which is the treatment aspect. So I'm going to touch the touchy topic, which is chloroquine and hydroxychloroquine. These are all peer reviewed. Now, when I say peer reviewed, it means lots of scientists, lots of doctors, clinicians, researchers have looked at it, looked at the evidence, and then they have made a recommendation. It will vary. It will vary from place to place. It will vary in Europe. It will not be the same maybe in America, because Mr. Trump is there. He makes his own guidance. It may vary in India, because India is a true free economy and true free healthcare, because you can go and buy anything off the shelf. Well, practically not everything, but you can just go to your chemist and say, okay, give me some chloroquine or give me some hydroxychloroquine. In UK, you cannot do that. You have to have a prescription for this. So you can't just simply go to a chemist or a medical store and say, give me chloroquine or hydroxychloroquine. Now, what is the evidence? Now, the hypothesis, because these are not proven treatment, they haven't been researched enough to claim that they work in COVID. So there are a lot of hypotheses, and they are quite weak when it comes to chloroquine and hydroxychloroquine. Even if they were effective, the effects would be very small. Now, in our first principle as a doctor or a nurse is do no harm. So we don't want to do any harm to our patients. And do no harm means you don't give something which may have serious side effects. Now, people are saying, oh, well, we have been using chloroquine for malaria for a long period of time, and hydroxychloroquine as well for many other conditions for a long period of time. But remember, the dosage is the key. We are using very small dose for those infections and diseases, as opposed to hydroxychloroquine for COVID. In COVID, the loading dose is very high, and subsequent doses are high as well. So what does that mean? That means the risk goes up proportionately. Now, without giving you much detail about what risk I'm talking about, just remember that these two drugs can affect the heart, the way the heart rhythm is. And they can cause heart to go into uncontrolled fibrillation, we call it. It goes like that. And that can lead to serious illness and death, possibly. So we always are very mindful of that as prescribers. Now, it is proposed that this drug should also be used in conjunction with another drug like azithromycin, which is an antibiotic. Now, I use a lot of azithromycin for my patients, so I know it very well at the back of my hand. This drug also causes the same problem. Now, you add fire and fire together, you're going to get a big fire. And that is exactly what happens. So we have to be very careful who to give these drugs and what is the evidence behind it. So for now, there is no clear-cut evidence that chloroquine and hydroxychloroquine does help in treatment. So the jury is still out. We are still looking at evidence. Now, this is the drug which has made a lot of news, apart from the Mr. Trump's chloroquine, is remdesivir. Now, remdesivir was originally, this is an old drug. This is not a new drug. This is an old drug. This is not currently made. It was there for a while. It has been tried in many other conditions, and it has been tried also for the old, the SARS, the MERS. So they have tried it in SARS-like viruses. There is a lot of political gain in this. Now, as you would know, that America is going into election very soon, this winter. There's a lot of stake in America. So it would not be unfair to think that there were a lot of political intervention in this drug. This drug was actually first tested in China, and it was shown that the drug did not work. Yes, the numbers were small. Then the Americans did the trial. It was supported by lots of other governments as well. The money was given from, Europe, UK, Japan, and the American money. And it was done by in some ways by the American government or government agency. The drug halfway in the trial. So when we start a study, a research, we say, okay, we are going to look for a particular outcome. So just think of it like a cricket match that you started with 50-over match, and then you decided that the rules has to change. So the player has already played 30 overs, and then you say, oh, the last 10 overs, which is power play, we are going to cancel it. Now we are going to have a different rule. That is exactly what happened with remdesivir. Initially, the idea was to look at, does remdesivir protect people from dying? Midway, they did an analysis and said, you know what? Remdesivir is very useful to those who are not taking it, who are taking it, as opposed to those who are not taking it. So what we will do is we'll give everyone remdesivir now, and we will close the study before the final outcome. And the outcome they took was how many people get discharged early. So they concluded that instead of 15 days of getting better and discharged, people are taking only 11 days. Now that became the primary endpoint. That you don't do in research without thinking about the consequences. And that is why it is something which not many of us are convinced that remdesivir is going to reduce the number of deaths as claimed by the study and the government. So what we can take it from here is that, yes, it is helpful, but as doctors who look at evidence, we can't say that this saves more life than giving a placebo. A placebo means nothing, a mint chocolate, basically, which looks like remdesivir. So giving something which doesn't have any active ingredient. So that's the myth and fact of remdesivir. Now, there was another drug which I deal a lot with. It's called Kaletra. It's made by the same people who make remdesivir. Now, it's made by Abbott, so a different manufacturer. Now, that is a HIV drug, and I am a consultant physician in HIV, and I deal with it, I've dealt with it for a long time. And some of the Indian publications showed that Kaletra works very well. You would hear it as lopinavir and ritonavir, the two medication combined together. Now, there's absolutely nothing evidence-based about it. yes, people gave it and some people got better, but they might have got better anyway, even without any medication. So we have to be careful before we proclaim victory over this. So how about vaccines? So as of now, there are about 25 to 30 vaccines who are being researched in all the parts of the world. And as Pradip mentioned, I'm also very interested to know what is the progress. Now, with a big pinch of salt, as we say in English, he very carefully, we have got some good news. And the good news is that one of the groups, the Oxford group, they are working with a very UK's biggest manufacturer of drugs called AstraZeneca. You might have heard of it. India will have a lot of drugs made by this company. So AstraZeneca has partnered with the Oxford group, which is part of the government agency, and they are working on a possibly successful candidate. So the early trial reports are very encouraging. However, the catch is it hasn't been rolled out to see in a bigger population कि भाई 1000 लोगों में कैसा होगा, 2000 लोगों में कैसा होगा, 20,000 लोगों में कैसा होगा. So all that has to be done. But what AstraZeneca has done, which is unprecedented, इससे पहले I have not heard of this, they have already started manufacturing the vaccine. They are hoping to supply 2 billion doses of this vaccine. 2 billion. And that is a massive number considering the population of the Earth, on this planet is 6.5 to 7 billion. So by September, they would have had several thousands, and then, rolling it out will take time. What they have done is they have taken a very big financial risk. Now, as you all are accountants, or many of you are accountants, you can imagine they are investing in something which has not been approved, which has not got much data. So the good news is that a company would not do that unless they have a very strong belief that this is going to work. So I'm hopeful, I'm optimistic that by the end of this year, we may have a vaccine. Now, if you go by the usual vaccine production, or even in this type of situation where it's very accelerated, कि 6th gear पे गाड़ी अगर जब चलेगी, उसके बावजूद अगले मार्च से जून तक was the earliest. उससे पहले हम लोग उम्मीद नहीं कर रहे थे कि उससे पहले कोई वैक्सीन प्रोड्यूस होगा successfully. But let's see, time will tell. Although there is a little bit of hope. Now, this is from the BBC News. As you can see that they have published it, and they have come out in public that they have already started making the drug. So, dear friends, now I'm coming to the most important part of my presentation, and this is about you. It's about your physical and mental well-being. Remember, this is very, very hard. This period has been really hard for everyone staying indoors, and it has had lots of effect on your mental health, on your physical health, as well as your financial and economic health. So there will be fallouts. We are dreading that many of the people will now start showing symptoms, maybe physical. There are people in US, in UK, who have not been coming to the accident and emergency or the emergency department, even though they have had heart attacks, even though they have had very serious problems. They have problems which may be signs of cancer. If you are in India, for the last 3 months, you would be lucky to find a doctor in the first place to do anything other than COVID-related things. So, and I have got personal experience about it. I've got family members who had to go through this. So you might be even in a worse situation. And believe me, everything coming on the WhatsApp, the Facebook, a lot of it has been not evidence-based. And therefore, you have, especially the media, Indian media, people can't make out what is truth and what is not true. So you have to really look after yourself. How are you going to do? Well, you know that it's a big stressor. Every day is changing. You're worried about being sick, isolated. There's loneliness. There is loss of income. People don't have food. They don't have shelter. And well, maybe all of you, but there are lots of others who may not have. And those who have, now they are working in a totally different way, unprecedented. Zoom has had, I think, 10 times their business has gone up in India because everyone is staying at home, working from home. And there was shortage of essential items as well in the beginning. So all this will lead to symptoms of stress. You can have headaches, sleep disturbance, all kinds of things, nausea, constipation, lack of appetite, your heartbeat, your heart rate might go up, you can't concentrate properly, you are very anxious, you could be very irritable, you might be very sad, and you are listening to news and you are thinking what is happening. And nature hasn't been very kind to India at the moment, because you have got corona, then there are a couple of cyclones, and then you had locust infestation, and then you have got the bhaiyas and the didis. I'm talking about the politicians. So, well, they're everywhere, to be honest. So, unfortunately, we haven't had a very good year globally, but certainly also not in India. How do you reduce the stress? Now, I'm not a psychologist, I'm not a psychiatrist. So please ask for professional opinion and advice. But I do look after many people who have stress. So after this presentation, don't go away now, don't leave the presentation. But after this presentation, read a bit less about the COVID, check your social media, and look for some light things rather than all the doom and gloom. Try and keep positive. But when I say keep positive, do not undermine the facts. So the fact is people have had COVID. Fact is people are dying. It's not a hoax. But look at the slightly positive sides of life. Also, understand the risk to yourself and those who you care about. Don't burden yourself for everyone. You can't save everyone, believe me. And also, you can't do everything for everyone. Do little bits for those who are near and dear, but also do as much as you can for others. So you could do charity if you can. You could work for them. You could do some help, and that will make you feel better as well. But be careful. Use those masks. Protect yourself before you do any of those things in the fields. Now, try and separate rumors from the actual facts. And there's so many on the WhatsApp University that I can't tell you, and you know it. Be careful. Get some good sleep, eat healthy, and do some exercise. Not going out doesn't mean that you can't do exercise. You can still do exercise inside your house. You can do on the balcony. You can do on top of, what do they call it? On the rooftop, on the chatta. Okay, plan your day, prioritize your tasks, make some good decisions, and enjoy yourself. Listen to music, listen to Kishore Kumar, listen to Lata Mangeshkar, whatever makes you happy. Yeah. And if I can go a bit more, I can say, okay, help your spouse, help your wives, help your husbands to do things which they traditionally do. Chai, khana, whatever. Anyway, they are demanding nowadays to help them. So go and do those things. Okay, now I'm going to run through myths of fact slides, and I'm going to give you quick answers to that as well. So I've had a bad cold before Christmas, which is last December. That was difficult to shake. It wasn't going away. Could I already have COVID-19? Now, my friends, the first reported case was end of last year. Globally, in India or in Europe, it did not reach, we think probably about February or so, or even late January. So yes, you may have had a bad flu, but you did not have the COVID-19. So that's a myth. If someone is saying, oh, last November I had, or last December, very, very unlikely. Next one, is it safe to take ibuprofen when I have symptoms of coronavirus? Now, a lot of people have asked about this in the past. So as you all take Brufen or ibuprofen, which is a medical name, and worry about it, because there were lots of reports of ibuprofen or similar medication increasing the risk of getting it or making it worse. It is true that there is some medication which are called ACE inhibitors, use the ACE, which is an enzyme, to get into and establish in the body, and corona does the same. But there is no link between these medication and the corona. So yes, it is safe to take ibuprofen. We don't need lockdown. Social distancing would have the same effect. Is it a myth or a fact? Well, you need both. And we needed both because the rate at which it was spreading, just social distancing was not going to help. So at that time, corona lockdown was important. All flu-like symptoms are coronavirus. Myth or fact? It's a myth because you have lots of other viruses which causes it. Chloroquine, hydroxychloroquine, is it effective for treatment or prophylaxis? So some people said prophylaxis also it is useful. There is no evidence unless we prove it otherwise. Coronavirus survives for weeks on some surfaces. Myth or fact? It's not weeks, probably days. So it is a myth. The longest modeling shows is probably week, or maybe just over a week, but not weeks. It's usually 24 to 48 hours, and more so on a plastic surface. If I can hold my breath for 10 seconds, does this mean I don't have coronavirus? Myth or fact? Well, those who do yoga can hold it for, much longer than that. So that doesn't mean that it's a fact. So it is a myth. Diarrhea is a coronavirus symptom, even though this is a respiratory virus. The answer is yes, it is a fact. People can get diarrhea, even though coronavirus mainly affects the lungs. It only affects older people. That is, again, myth. However, it is a fact that if you get it more than 80 years of age, you have 10 times more risk of dying than if you're getting it at a 40 years of age or 50 years of age. So yes, the risk of dying is much higher if old people get it. Can all hand sanitizers can protect you from coronavirus? It is a myth because all hand sanitizers don't have enough of the alcohol gel or alcohol content. It has to be at least more than 60%. Spraying chlorine or alcohol on the skin or drinking alcohol kills COVID? Well, you can make an excuse to have a drink. However, it is a myth. There is no evidence that it helps. It is unsafe to receive a package from infected countries. So yeah, I'm not going to comment whether you want to buy things from China or not, or whether you want to buy anything which is Chinese made. However, if you are importing anything, or even within India getting anything sent from the package, it is a myth that it will cause transmission. To be safe, you could leave it out in the sun or leave it for 24 to 48 hours just in case, but there's no evidence. Gargling, using mouthwash, keeping your nose clean, does that protect you against coronavirus? They may all be good practice. However, there's no evidence that it prevents corona. Hand dryer kills the coronavirus. It is again a myth. Hand dryers are only like drying your hand. They're not killing the virus. And one should wipe down all the food items from the grocery store before putting it away. Is it a myth or a fact? Well, if you want, you can clean some of the things which has got plastic packaging and all. However, you don't have to clean everything. Well, you wash it as you usually would. Right. I'm coming nearly to the end. There is risk of disease transmission from clothing exposed during work. This is important because now you'll be going out and working. Well, there is some truth in it, and therefore, there's no documented case, but it is possible. So it is always a good practice to come, change your clothes, and have a good shower before you interact with your family. And flu and pneumonia vaccine will protect against COVID. That is against, will not protect against COVID. That's the fact. They don't help with COVID-19. And this is another crazy one. 5G helps COVID-19 to spread. And there was lots of media hype. It is a myth. There is no evidence whatsoever. Thank you.
You mentioned in your presentation, washing of hands are most important thing.
Yes.
It is, and you have mentioned in your presentation that it is going to stay with us, and we have to move forward with this COVID-19 with the precautions like social distancing, mask, and sanitation.
Yes. So till we get a vaccine,
yes,
we are not going to have anything real which will have a good degree of protection. And there'll be lots of claims. There are already lots of claims about medications and others. However, the truth is we need a vaccine, hopefully by this December, if not by March or June. Till then, hand washing, prevention, having a bit of social distancing, that is probably what all we have got.
So in last 2.5 months, everybody is educated about SMS. Well, and you have very well presented these three words, how we have to take care to move forward with this problem. Now, we have seen that Italy and Spain have breakout and their chart is like this, V or U shape. But in India, its shape is increasing.
Yeah.
Can you tell us when our in India it will be breakout or our shape will be like V or U?
So you have to realize that the Italian and the Spanish pandemic or epidemic that started earlier than in India. Also, India is a much larger country. So we in some ways have many countries within a country. Our policies have been different in different states as well. So there's no centralized, as I understand, and correct me if I'm wrong, but as I understand, there's no single central policy. What has happened is in Spain and in Italy, there are many more elderly people, and in UK and America, compared to India. So India has got a very young population. So the spread of any disease depends not just on the virus or bacteria, it depends on the host. And if the host immunity is good, it just automatically slows down. And that, to some extent, is where the Indian pandemic has been slow. But remember, slow doesn't mean it has stopped. And if you will realize, the death in the last 2 weeks in India has been the same number as in the last 2.5 months
Right.
or 2 months. So your doubling in India has really gone up. The doubling, if you look state-wise, I was looking at some data, and so Maharashtra, I think, has a doubling rate of 8 or 10. So it just means that the rate of infection being twice as many has gone up dramatically in India. So India has not gone past the peak of the curve, I think. I'm not a statistician or an epidemiologist, but I don't think we have reached there where we can say, because you have to have a consistent, almost a week, 2 weeks of data where infection rate has gone down, less infection, less death, then you can say you have passed the peak, because the fluctuation in the graph will happen. And all of you follow stock market. If anyone has ever seen a stock market graph like that, has never done accounts. So it always goes up and down. That is the fluctuation in time, and that is a natural phenomenon, happens with everything.
So we have heard in the news that first of all, the breakout will be in two states like Mumbai and Delhi, where the effect is maximum. And we have seen that death rates have come down from 7.7 to 3% in Mumbai recently, as the data shows. So we will take the questions from the delegates who have given in the chat box. And my first question is that when only 250 cases were there, that there was complete lockdown. Now we have the figure of around 2.5 lakhs and everything is unlocked. So, and everybody is ready to go for work, whether it is safe with the precautions or anything else you will suggest.
So if I can come in, firstly, people have to understand what that 250 meant. At that time, the population was never exposed to this virus. So लोगों ने उनके लिए ये first time था. We suspect that even with very conservative R0, so risk of infection to others, a lot of people in India are probably already infected. They are not a case because they haven't been tested. They don't know about their status because there's no test which can tell them. There are antibody tests, but they're still not very good. So therefore, if we don't know the real infection, we can't talk about how the infection will spread. If you estimate that infection has gone into the normal population as it would have done in the beginning, there are many people who are already infected and they haven't had the symptoms or mild symptoms, and they will have the immunity, as we know now, for good 6 to 12 months. So they are not going to then pass it on to another person. So R0 will come down slowly, and I'm sure it is coming down in India as well. Therefore, is it safe to go out? Well, there is no one who can tell with certainty, is it safe to go out? But is it safe to stay in? How long are you going to stay in? Because there's a lot of mental and psychological and financial effect of it. So what we would advise is, like we always say, use the principle of middle path. Be careful, take the precautions, and do your usual as you would. So a lot of you guys who are going to work, you can work from either home or even in offices without being in face-to-face contact with your clients, isn't it? Yeah, a lot of it is electronically generated. All your Vahi Khata is all electronic now. Is that correct?
Right.
Yeah.
Absolutely.
So avoid unnecessary physical contact or physical meeting up. Of course, in the family, you are always there. So there's nothing you can do about it. Or your neighbors, you will have to come out someday and say hello to your neighbor or to your chai wala or pan wala, and just maintain those basic rules of social distancing and taking precautions. But I think it is time to try out slowly going out.
next question is from CA Vishnu Tulsian. Do rain spread the corona?
Well, I'll come in between. I think I've already answered that. There is no proven study that rain spreads corona. The droplet spread, what we are talking about, is generated by humans, and it is bare minimum within the 2-meter range, which happens. I don't think the wind or rain is capable enough to carry it, but it is a very debatable, very nice question to be asked. And what we don't have any evidence to comment on it, but what I can carry with the flow of the wind or whatever happens in Bengal, that was in the Bengal perspective what you've asked. I don't think rain is responsible for spread of corona, because the rise of corona has not drastically gone up post Amphan. It has been steadily up the way it was. Okay, the more the tests are happening, the more we are identifying the cases. So I don't think the contribution of rain is there at all.
I totally agree with you, Pradeep. There is no evidence showing that rain or sunny weather will automatically, get rid of it. It will have its natural decline. We know it will slowly go down. The problem is a second wave. I think my worry is second wave.
True, very true.
So
I'm there.
I think we have covered all the queries raised by the delegates present here. So any member wants to raise any query, or we come to an end? Hello? Am I audible?
Yes, we can hear you.
Yes.
Sir, I had a question to both the
Yes.
panelists. So, any comment on the Lancet retracting its study where it had criticized HQC as being more dangerous because the data was falsified and all?
Well, I think I've touched on that topic. The SCQS trial was kind of stopped by WHO because there was no much benefit noted in prophylaxis as well as treatment. But retracting from it and reconsidering the trial can be more of a, you can say, a pharmacological, economical move. And if you go with an evidence-based, there is still no benefit. Rather, it's quote unquote, it is in bracket. If I have to talk about my trust, I think Dr. Rajesh will help me on this. What I gather from my trust who are taking part in all the research is they are saying the least benefit, rather no benefit, what they have noted is from hydroxychloroquine. And from the hydroxychloroquine, they have got almost like a no benefit. And they're still very hopeful with remdesivir, but the evidence is still not up to the mark. So this retracting and going with a retrial can have many motives which may not be scientifically kind of proven. So it is time which is going to tell us what was the intent and what will be the research. If any research comes out, then we can debate on it, and then we can contradict with things or data is what comes out. So the intent is not known.
Absolutely. I think we have seen enough here, and we are part of 2 trials, which is looking at all these drugs, and chloroquine and hydroxychloroquine, or hydroxychloroquine mainly, has had, no particular effect, and the risks of it at the dosage which is given. What people don't get it, that you're giving a lot of hydroxychloroquine rather than the usual dose for other illnesses. And that has a real potential of harming. So the American stance, yes, they are one of the best journals on this planet, but remember, the best can get, I wouldn't say corrupted, but they can get sidetracked under political pressure.
Yeah. True.
So, thank you, Dr. Rajesh, for sharing your real life experience of COVID. And we can conclude that we can venture out with the
precautions
as suggested by our learned doctors, and we should wait for the vaccine, which will be the proven solution, and we should hope that it should come as early as possible. With these I would invite Vishnu Tulsian for the forthcoming programs in very short. So because we are already very late, Vishnu, please.
Thank you, Via. Audience, your organization is having the following programs in pipeline in the coming weeks. It is for your record as request to join. On Friday, 12th June, we are holding a program on GST by the speaker from New Delhi, Bimal Jain, and Central Council member Sushil Goyalji. On 13th June, we are having the program of internationally acclaimed motivational speaker Sri Ujjwal Patni. On 14th, we are having the program from Dr. Piyush Saxena from Mumbai on the naturopathy. He has done the PhD from the US. And on 15th June 20, we have the program of, we have the last date for submission of the drawing for the children's. So you all request to please avail this opportunity and enhance your knowledge. Thank you.
So now we are coming to an end of this session, and I am inviting General Secretary of our VIPCA, Bajrang Agarwal, for formal vote of thanks. Bajrang Agarwal, please unmute.
Thank you, sir. Good evening, Dr. Pradip, sir, and Rajesh Hamberam, sir. It's my proud privilege to give formal vote of thanks to both of you. My first vote of thanks goes to Dr. Pradip Singh. Sir, your information about COVID is very informative to all the members. This awareness about the COVID is much more effective to our members. Your reply through chat box of all the queries to our participants is really remarkable. So on my bottom of my heart, I thanks to you for participating this program and giving awareness to all the participants. Thank you. And my second vote of thanks goes to Rajesh Hamberam, sir. Sir, your first demonstration about how to put the mask is really very effective to all the participants. We hear 2-3 webinars before this, but I don't know how to use and put mask in our face. It's really very useful, and all the facts and queries about COVID-19 is also remarkable. So there are lots of WhatsApp gyan and Facebook gyan and social media gyan. So everyone confused, but from you, from your mouth and doctor's mouth, we heard too many things. So it's very useful. And one important thing, your useful informations about all the COVID pandemics is so much useful. And one more information you give us that the vaccine will come on December is really worried about us, because I think before October, before Durga Puja, we got vaccine to all the citizens of the world.
No way. It'll be impossible nearly to get it before September, October.
Yeah. Hope for best, sir.
Yeah, we are hopeful. We are hopeful. Yeah, but we have to be realistic. We were first thinking it will be next March or June. So if it comes by December itself, it is a big victory.
Big victory, yes. It's good. And once more, I thanks to you. And I thanks to all the, first of all, our past president, Sri Vasudev Royalji, for conducting our webinar in effective manners as a coordinator. And I thanks to our webinar chairman, Sri Vishnu Tulsian, and Rahul, and Anil Achalia, and Neeraj for organizing such a good seminar and webinar. And last but not least, I thanks to all the participants of the webinar for participating in this webinar, and truly it's more successful. Thanks to all. Over to the, so now we conclude our webinar for today evening. Okay, sir. Good night.
Thank you.
Oh.
Thank you.
Thank you, Rajesh. Thank you, Pradip ji.
Thank you. Good night to
Thank you, sir.
everyone.
Good
Stay
night,
safe.
good
Good night.
Thank you.
Good night.
Thank
Stay
you,
home.
everyone.
Stay safe.
What are the times in the UK now?
I'm going to have my lunch.
We are preparing for the dinner.
Yes, it's 3 o'clock.
Wow.
Yes, yes, yes.
Thank you.
Okay. Thank you.
It's
everyone.
8. Is it 7:30 there?
It is
Yes,
7:34.
yes.
Yeah,
7:34.
7:30.
Keep some food for me. No free dinner. Yeah, keep some food for me.
So,
And one more suggestion about that kindness. We are one information that our association